Hi, I'm Megan Call with Mainline Health, and joining me today is Dr. Maribel Hernandez, a cardiologist with Lincoln Heart Institute and medical director of the Women's Heart Initiative at Mainline Health. Mainline Health has the largest female cardiology staff in the region, with 13 female cardiologists across all of our 4 hospital campuses. And as the Philadelphia Goes Red champion for the last 10 years, we've partnered with the American Heart Association to build healthier lives free of heart disease and stroke. Lincoln Heart Institute has developed the Women's Heart Initiative program, a dedicated program for women that offers personalized guidance, support, and resources that a woman needs to take good care of her heart, from information and preventive screenings to experienced doctors and specialists educated in women's heart care. It is an excellent resource for women in our community, but it's not all that we're doing here to demonstrate our commitment to women's heart health. So let's get started. Thanks for joining us today, Dr. Hernandez.
Thank you for inviting me.
So as a cardiologist, but more importantly as a woman, why is it important for you to educate women about heart disease? And why should women be concerned about heart disease at all?
Heart disease remains the leading killer of women. It kills more women than all combined cancers together. Unfortunately, only approximately 44% of women are aware that heart disease is the #1 killer. That can be broken down into racial and ethnic groups. It turns out that in white women, there's more awareness. It's still low, about around 50 to 60%, as opposed to Hispanic women, there's only 30% awareness. When talking to women who have suffered strokes or heart attack, we find that they are very surprised that they have a heart problem or symptoms of heart problems. And so we are finding that women do not realize that heart disease affects them too. It's not just a man's problem. And that women tend to overlook the symptoms and are not aware that all women are at risk for heart disease, regardless of the age, ethnicity. Therefore, all women need to be aware of their risks.
So those are some alarming statistics, affecting more women than all cancers combined. And again, the disparities between racial and ethnic groups. What are some explanations for the high rates of heart disease in women? Why is it so common among women?
It turns out that women tend to take care of their families, and they tend to overlook their own health. Therefore, there's a delay. Frequently, there's a delay in getting help or seeing the doctors or getting help if they have symptoms. They're not aware, many women are not aware of their own risk factors. Therefore, even though heart disease is preventable, 80% of heart disease is preventable, we're finding that women are not aware that they have heart disease and then take care of their families or their loved ones rather than take care of themselves.
So other than really carving out some time to really focus on yourself and your health, what are some of the risk factors that affect women for heart disease, things they might be able to change to control their risk?
Well, in both men and women, we have some risk factors we have some control that are modifiable. Those are blood pressure, cholesterol, smoking, diet, exercise, and alcohol intake. So these are risk factors that we have control and we can modify. There are some other risk factors that are genetic that we cannot modify. Our age, gender, sex, family history. Therefore, women need to be aware or which are their risk factors and which can be modified. I want to add that even if you have a family history of heart disease, it does not mean that it's destiny, that you cannot do anything about it. It turns out that studies have shown that even if you have a family history of heart disease that is genetic, if you take care of these other modifiable risk factors, you significantly can decrease your own risk and change the pattern in your family.
That's amazing, and some words of hope for people out there, I'm
Yes.
sure. So I was looking through A Woman's Guide to Protect Her Heart, which is a guidebook put out by the Women's Heart Initiative. And I was reading just about some of the new unique risk factors that a lot of women might not know about. Can you elaborate on those?
Yes, I feel very strongly that women need to be aware that they have unique risk factors which are not seen in men. This A Women's Guide to Protect Your Heart was put together by a group of female cardiologists in mainland health system with the help of some colleagues, male cardiologists. And we want women to be fully informed that there are other, in addition to those that are, I just mentioned, there are unique risk factors for women. Those include pregnancy complications such as preeclampsia, makes you a higher risk to have problems with heart disease in the future. Autoimmune diseases such as lupus, rheumatoid arthritis, cancer therapy, for example, breast cancer therapy with radiation to the chest, or there are chemotherapy agents who affect the heart. And your history of menopause, for example, early menopause without replacement hormone therapy makes you at risk for heart disease earlier.
Wow, I'm sure a lot of our audience will be surprised to learn that. So in terms of detecting these problems early, you talked a little bit about if you have a family member with heart disease, you can change that pattern. But are there any screenings or tests that you can have that might tip you off to heart disease early?
Yes. For patients who have a family history of heart disease, we encourage them to be evaluated early, not only because they're at risk, but that they may have some risk factors that they can modify starting early, meaning in their 40s, even late 30s. There is a specific test that we recommend. These are for patients who have risk factors such as family history, but may have other risk factors like diabetes, hypertension, high cholesterol, but who do not have symptoms. I want to emphasize this is a screening test, meaning you are not having symptoms. It's called the CT heart calcium score test. It's a plain CAT scan, a quick test. It's not expensive. And if it detects calcifications in the coronary arteries, it means that you're beginning the process of building of plaque. And that's an early, you can immediately start trying to modify any risk factors to prevent actually later on plaque buildup and a heart attack.
That's wonderful. It could be a lifesaver, literally.
Yes.
So in addition to screenings, what are some things that people can do every day to reduce the risk for heart disease? You touched on this a little bit earlier.
Yes. So the most important thing is to be active. And that doesn't mean that you have to go to a gym. Acting means that go up the steps, move. If you're at work, sitting down all day, take breaks and walk around. You might even go up the steps in the building. Park further away from a store or the grocery store, wherever you're going. So you have opportunities to move and walk. Ideally, it's recommended 150 minutes of moderate exercise a week. That can be divided in 10, 20 minutes. Every little bit actually adds on. So even gardening, doing work around the house, it all adds up. It doesn't have to be all at one time. And that's good news that it all adds up at the end. Mm-hmm. You get benefit. Other things you need to do is very important for women to quit smoking. And I want to give advice to the younger women. Cigarette smoking and birth control pills makes you a very high risk for clots. So in younger women, they should, if they smoke and take birth controls or hormone therapy, they definitely need to quit smoking. Having a supportive environment with friends and family also helps avoid depression and having support for stressful situations. It all helps the heart. Of course, a healthy diet. We like people to increase the consumption of vegetables and fruits, and follow a more low carbohydrate diet, Mediterranean diet style diet. And know your numbers. What does that mean? Find out what's your cholesterol level, what is your blood pressure, and if you need treatment, follow through and take care of yourself.
And so just to follow up on your question about know your numbers, this is a question that patients should be asking their physician, right? They should be asking about their numbers. What are those numbers?
The numbers that we talk about are what is your blood pressure, know your blood pressure, what is your cholesterol, but it's not just the total cholesterol. There is the good cholesterol, HDL, the bad cholesterol called LDL. And so learn not just the total cholesterol, what really matters is how high is your bad cholesterol, the LDL. That's very important number to know. Your glucose level, diabetes is a risk factor for heart disease. And of note is that women with diabetes develop heart disease much younger. And we're seeing that right now, an increase in younger women, less than 55 years old, having heart problems, including during pregnancy, because with the obesity epidemic, we're seeing more diabetes, which leads to heart problems. So those are some of the key numbers.
And as far as symptoms go, how would a woman or really anybody know if they were experiencing the symptoms of heart disease or of a heart attack?
Well, it turns out that in the majority of the women do get chest pressure. When I talk to my patients with heart attack, they always said it's not sharp pain, it's pressure. So I learned not to ask patients actually they're having chest pain. I do ask for pain, but I also ask for pressure and discomfort, and which is more common in men than in women. In women, what we're finding is the high number of women do not have chest discomfort or chest pain as a symptom of heart disease or a heart attack. Frequently, it's more shortness of breath with walking. For example, they are used to going up and down the steps in the house, and one day, suddenly, unexpectedly, they're getting more short of breath. Pain going up the jaw, down the arm, that's common in both men and women. But in women, we're also seeing upper back pain, not necessarily chest or arm. Severe fatigue. We have some patients that they just have this unexplained severe fatigue. Mm-hmm. When they're not having a virus and there's no other medical problem. And sometimes that means that the heart is not pumping properly and it's not getting enough blood flow, but they don't necessarily have chest pain. Some women have severe nausea and vomiting unexplained. So those are some of the symptoms that we have to look for, not just chest discomfort.
Okay. And so before we continue, we're going to take a look at a video from the American Heart Association that illustrates some of the symptoms described by Dr. Hernandez.
It started out like a totally normal day. Mom! Okay, move objection deadline to the third line after survey. Oh, honey, for when you always use the verb estar. What are you doing down there? Did you finish your breakfast? Ow. Don't hit your brother. I mean, you have to eat something. Here. Okay, 5 minutes to carpool. Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly.
Spaghetti.
You sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorite. See you guys later.
Where are your shoes? Put your shoes back on, please. You know, go help your sister. We're going in 3 minutes. Oh, my God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Honey, get your sister. Okay, get her. Nobody move! I'm getting a dustpan.
Oh. Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? I'm just gonna sit down. I'm totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not gonna wait. Whoa. Okay. 9, 1, 1. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas. Turns out I was having a heart attack. Heart disease is the #1 killer of American women. So now I take care of my heart and I tell the women in my life to do the same.
Sounds great, by the way.
That's nice, sweetie, but that's not my heart. That is. Make it your mission to save your life and the lives of the women you love. Find out more from the American Heart Association at goredforwomen.org.
So Dr. Hernandez and I were just talking during this video, and she really emphasized the importance of calling 911 if you see symptoms like these. Is that right?
Yes, that's very important. We find that women tend to call 911 for everybody else, their spouses, family members, friends, except for themselves. So that's a very important message, calling 911. Even if you're not sure if you're having a heart problem, it's better to get on time and get timely treatment for if you're having a heart attack.
Certainly important words for everybody watching today. So if you have a heart concern or you don't, how often should you be visiting your doctor? Does that change if you have heart problems? What's kind of the regular schedule of physician appointments?
I think everybody should have an annual visit with a primary care physician. If you have a family history of heart disease or you have risk factors for heart disease, it should be, I would say, either at least twice a year or more frequent as needed. Your primary care physician may refer you to a cardiologist, but at minimum once a year. And the reason is that 1 year you may not have high blood pressure or high glucose levels, and year to year things may change.
That's great advice. And so this is all great advice that women are getting as part of the Women's Heart Initiative program. Can you tell me a little bit more about Women's Heart Initiative and how that started?
Well, the Women's Heart Initiative program is a program across the Mainland Health System. It was formally started around 2008, and our goal is to educate women in the community about that heart disease is #1 killer, and educate them about risk factors, how to prevent heart disease. We also want those unique risk factors that I mentioned earlier be common knowledge for women and also providers, because the fact is that many of our healthcare providers are not aware that women have these other risk factors and they are not screening for them. We have risk assessment programs, educational programs, and very importantly, we have a support group for women with heart disease.
Yes, tell me a little bit more about the Heart to Heart Conversations group.
Yes, our program was started approximately 2 years ago. It's called Heart to Heart Conversations. It's for women who already have heart disease, but also we welcome women who are at a high risk for heart disease. It's a free program. It lasts around 1 hour. And we invite women of all health systems. We have women coming from downtown and other health systems. So it's for any woman who has a heart problem.
And as I understand it, there's another event coming up soon for the Women's Heart Initiative. Can you tell us about that?
Yes, we're very excited about our program coming up October 24th at Lancano Medical Center from 6 to 8:30 p.m. It's called New Horizons, Emerging Trends and Treatment for Prevention of Heart Disease. So our focus will be on prevention, but also we want to tell women what are the new guidelines, what's new in terms of prevention of heart disease. And I want to again emphasize that 80% of heart disease is preventable. 80%. So that's why we're focusing on prevention.
And so if women are interested in signing up, they can visit mainlinehealth.org/hearthealthy, and they'll find a little bit more information there.
Yes.
Wonderful. So before we wrap up today, Dr. Hernandez, what is your takeaway? You are a big proponent of women being advocates for their own health.
Yes, I feel passionate about this. Women, especially in heart disease, need to be their own advocates. For many years, the focus had always been in terms of research and treatment, and education has been focused on men. So I encourage women not to wait to have your doctor ask you about your risk factors of heart disease. See your physician, come prepared with questions. Ask your physician about what are my risk factors, what can I do to prevent. If you feel that you have symptoms are being dismissed as anxiety or stress and not being further evaluated as they should, you need to seek a second opinion.
I think that's really valuable.
Yes.
Thank you, Dr. Hernandez, for being with us today. I'm sure this will be really valuable to the women watching. Thank you, everybody, for joining us. And before we go, we have a look at Mainline Health's efforts to help women with heart disease feel seen and beyond.
Nothing is more personal than your body, which makes treating it our privilege. At Mainline Health, when you're at your most vulnerable, we see it. We see hope. We see options. And in your loneliest moments, we go out of our way to see you. Because what is healthcare if it's not human?